Hi, welcome back to my channel. In this video today we will discuss about thyroid nodules. So the incidence of thyroid nodule is almost 50%, and out of them less than 1% are cancers. So according to the ultrasound assessment of thyroid nodule, there are 5 kinds of thyroid nodule. U1, then there is U2, U3, U4 and U5. This is the ultrasound based classification of thyroid nodule. So let's read about them one by one. So U1 is normal thyroid. Mm, there can be a nodule, but it is usually benign. And then there is U2 is also benign. This is hello isoechoic or mildly hyperechoic. This will be the ultrasound finding of thyroid, that they will mention that the thyroid is hello isoechoic, mildly hyperechoic, cystic changes, plus minus rings down sign, which is colloid inside the thyroid. Then there can be microcystic or spongiform, then peripheral axial calcification and peripheral vascularity. So these are the 6 features of benign thyroid nodule. First one is normal thyroid, second one is benign thyroid nodule, third one is indeterminate or equivocal. So in indeterminate or equivocal, homogeneous hyperechoic, markedly hyperechoic. So here it is mildly hyperechoic and benign, while in indeterminate it would be markedly hyperechoic, solid halo follicular layer, hypoechoic, equivocal echogenic foci, cystic changes would be there, are mixed and central vascularity. So the peripheral vascularity is considered as a part of benign, while mixed or central vascularity is considered as a part of indeterminate thyroid nodule. Then there is a suspicious thyroid nodule. Suspicious thyroid nodule usually solid and hypoechoic. Always remember, if the shadow is less like hypoechoic, it is suspicious. If the shadow is hyperechoic, then that is benign. So solid very hypoechoic of stressed muscles, solid hypoechoic of thyroid, disrupting peripheral calcification. Here it was axial calcification, while in suspicious there will be peripheral calcification, hypoechoic and lobulated outline. And last one is U5. U5 is definitely malignant. It is usually solid, hypoechoic, lobulated, irregular outline, microcalcification, papillary carcinoma. So it can represent, with microcalcification we can say that it is papillary carcinoma, but definitely ultrasound is not a confirmatory to confirm a type of cancer. So for confirmation we need to go ahead with the biopsy. Or it can be solid, hypoechoic, lobulated, irregular outline with globular calcification. If there are microcalcification, they are usually a feature of papillary carcinoma. If there is globular calcification, it is in medullary carcinoma. Then infranodular vascularity. So that is also an important point, because peripheral vascularity is a part of benign, while intranodular vascularity or central vascularity is a part of malignant. And then their shape, it will be usually more taller than wider. Anteroposterior is more than the TR. And characteristic associated, there would be lymphadenopathy along with that. So these are usually 5 features of malignant. Let's quickly revise them. First one is U1, which is normal. Then U2, which have peripheral axial calcification and peripheral vascularity, and this would be benign. Then U3 would be equivocal. Then U4 is suspicious, and U5 is definitely malignant. Again, these are the features. And finally, U1 and U2 nodules should be regarded as reassuring unless the age is less than 20 or more than 60. So if the patient does not qualify this criteria, then these lesions are usually nodules are usually suspicious, and we should go ahead with repeating ultrasound or biopsy. So they are should be considered reassurance unless the age is less than 20 or more than 60 years. It is firm on palpation, rapid growth, fixed to adjacent structure, vocal cord paralysis is there, regional lymphadenopathy, history of neck radiation, and family history of thyroid cancer. Then we should go ahead with the next step. And if this is a U3 to U5, always go ahead with FNSE biopsy, which is fine needle aspiration cytology biopsy. Okay. So just to quickly revise this topic, thyroid nodules are very important for SCE exam, and also in our daily life we will encounter such problems in our clinics as well. So the incidence of thyroid nodules is usually 50%. Out of that, 1% are cancer. So the incidence of cancer is very less in thyroid nodules. And then on the basis of ultrasound, they are divided into 5 types: U1, U2, U3, U4, and U5. Out of this, U3 to U5 need FNAC, and U1 is definitely normal, and U2 and U1 are mostly benign and reassuring unless they qualify this criteria. If they qualify this criteria, we should go ahead with the FNAC biopsy. That's it about the ultrasound guided classification of thyroid nodules. Next, we will study about FNAC findings and types of FNAC biopsy findings. Thank you.